Welcome back to Ask a Midwife Anything. So, I wanted to touch on what happens when you have an ultrasound and it's not showing what we think it's going to show, specifically looking at not seeing a heartbeat. So, this can be really difficult for a lot of people because it brings with it a sense of unease and not knowing what's going on, especially if you're anticipating being further along, and that's not what the ultrasound shows. So, sometimes what can happen is people can go for an ultrasound and we can either just see a gestational sac, which is basically exactly what it sounds like, just a circular sac inside the uterus. Sometimes we can see a fetal pole and a yolk sac, which is the beginnings of the start of a growing embryo. But in all three of these cases, there's no heartbeat like we would expect or anticipate. So most of the time, what this is that the pregnancy is just a little bit earlier than we thought it was. And so given some time, the rest of this will continue to develop and progress normally. What is standard for us at this point is to get some hormone levels. So basically we'll draw what are called quants or beta quants. This is checking the hormone levels. And what we're doing is looking to see if they're rising. We will typically repeat these levels in 48 hours. So the day that we get the ultrasound back, we'll do one then and then repeat it 48 hours. And the big thing is that they're going up. Now, there can be lots of guidelines with regards to how much it should go up. Lots of people have heard things about the quants doubling. It doesn't always have to be like this, though. And I talk to patients a lot of times and say it needs to be an appropriate rise, which I know is a very, very vague statement. But we want to see that it's going up a good amount, but it does not have to double. We will then usually order another ultrasound to be repeated in 10 to 14 days. This way, that gives it enough time to develop so that we can see a heartbeat and know that everything is okay. But this can be a very trying time for people. The waiting until we can confirm that something is okay. And sometimes it's not. Sometimes we see a gestational sac and nothing develops in that gestational sac, and it's something called a blighted ovum. Sometimes a fetal pole and a yolk sac will develop, but won't develop any further than that. So that is where a lot of the unease can come in, is because there is that potential that it's not a viable pregnancy. And we often are in limbo until we can confirm that. Now, sometimes the hormone levels will tell us that. So if the hormone levels are going down instead of going up like they should, that can be more of an indicator that no, this isn't, that it's too early. It's just that the pregnancy is not viable. And there's also some nuance to this, and things can be repeated, and it doesn't have to be black or white. Sometimes people want confirmation of viability or non-viability, even dependent on what the hormone levels are doing, and that's okay. The big thing is just being aware that sometimes there is a little bit of this limbo for a week or two until we can confirm that everything's developing as it should in the pregnancy. If you have any questions, give me a shout out. Have a great day.